The time now is 8:10. Could a big intervention by a leading group of doctors and surgeons help stop the strikes plaguing our health service? The Academy of Medical Royal Colleges has made a significant move today of the kind they generally avoid. They're saying that independent, third-party arbitration is now necessary to get an agreement between junior doctors and the government. The last time the Academy made such an intervention several years ago, it proved effective in ending the impasse. This time, the Doctors' Union, the British Medical Association, who we'll hear from in just a moment, that's the BMA, says it has already contacted the Conciliation Service, ACAS, but the Department of Health said that there were no plans to involve a third party, and the BMA's pay claim of 35% was unreasonable. So as of this morning, we are stuck. This country's health service was under immense and growing strain even before the pandemic, and the additional impact of that pandemic and now these strikes is cancelled appointments and operations and, ultimately, avoidable deaths. Nobody in this dispute wants that, so how do we resolve it? In a moment, we'll hear from the chair of the BMA. First, Professor Dame Helen Stokes-Lampard is the chair of the Academy of Medical Royal Colleges and joins us now in the studio. Helen, good to see you. Thanks for coming.
Good morning.
We were hearing from Hugh Pym, our health editor, earlier. He noted that you're a venerable, cautious academy. You don't often speak out, but you are now. Why are you making this big, rather unusual intervention?
We are a week on from the peak of the most disruptive junior doctors' industrial action in the history of the NHS. You've heard the headline figures of 196,000 procedures delayed or postponed. Actually, the reality is profoundly more than that, as that is only counting what has been counted. Many hospitals didn't return data, and general practice wasn't asked for data about this, so the reality is far greater. And that is going to take an awful long time to make up. And in the meantime, patients are suffering, but also this dispute, which nobody wants, the doctors are suffering too, it needs to be brought to a conclusion. And before you can even start to have negotiations, you have to have preliminary talks to set the parameters. And what worries us as an academy, and we are very much not a trades union, we are the body, the membership body for doctors, is that doesn't seem to be any preliminary talks about talks, if you like, happening. And that's all we're urging. We're urging some flexibility on both sides. That's the Junior Doctors Committee and, of course, the Department of Health and Social Care. And if it takes a third-party intermediary to do it, fine. We're agnostic as to what that intermediary is. It doesn't matter who or what. It's that things start to move forward.
But with your long experience in medicine, in the sector, can you give us a sense of how concerned you are by what you're seeing with your very own eyes?
I'm gravely concerned. I happen to be a frontline general practitioner, and in my practice on Monday, I saw several patients who'd had procedures delayed and cancelled and postponed, people who are there in pain, people who are suffering, and when their procedures are rescheduled, that's going to push somebody else down the line. We have the longest waiting lists in NHS history, for reasons we all understand, the pandemic compounded by over a decade of underinvestment in our service. And we have a body of junior doctors who are hurting. They're angry, they're frustrated, they're burnt out, and they are leaving our profession in droves. They need looking after.
Doctors grapple with huge ethical dilemmas every single day, but can you just take us into the mind of doctors who are grappling with an additional ethical dilemma now because of these strikes?
Yes, certainly. We have ethical duties to do no harm, to do the best for our patients. And so the dilemma is the balance of the chronic long-term harm that underfunding has done to our NHS versus the short-term harm that is undoubtedly done when industrial action is taken. And that is what each individual doctor will be wrestling with as they choose whether to take industrial action or not. And there are a range of views amongst doctors. Clearly, there are some who are very, very polarised, but the majority are somewhere in the middle on that spectrum of views. But all of us are hurting. All of us want a resolution to this. All of us want our NHS in a better place.
You paint a picture of two parties who are not even at the negotiating table. As you say, they're not even talking. How would you compare that with what happened with the junior doctor strike 7 years ago? Because that seemed to be resolved much more quickly.
Memories are strange things. That was quite a long process too. But at least the talks about talks were happening much earlier, is my recollection back then. The intervention by the Academy then is when we spoke out and said, enough is enough, strike action must stop. We have not reached that point yet. We do not want to interfere in individuals' right to take industrial action. What we do want is for both parties to make some flexibility, make some compromise, come out of your entrenched positions, and please, please, start talking. Whatever it takes to start talking, let's do it, because this won't be resolved without talks.
All right, Dame Helen, very good to see you. Thank you for coming in. Let's put that directly to Dr. Philip Banfield, who's the chair of the BMA Council. Dr. Banfield, good morning.
Morning.
Thank you very much indeed for joining us. Were you able to hear Helen there, Professor Dame Helen Stokes-Lampard? Were you able to hear what she said?
Yes, I was.
Good, because
there's nothing to disagree with there at all, is there?
Well, you told me it sounded very much like she was speaking to you, and she directly to you, actually, as she was speaking to the government, when she said we need some compromise. What do you make of what she said in terms of the need for compromise urgently and at least beginning to talk about talks?
Well, what's interesting about this, doctors are the solution, not the problem. And what I'm fairly amused by is the way that the workforce is seen as a cost rather than an investment. We have got the longest waiting lists ever. It is not the strikes that have created those waiting lists. It is chronic underfunding. It's running down the workforce. We've got 10,000 doctor vacancies. We are under-doctored compared with Europe. If we had the European average, we'd have 40,000 more doctors. So, this is a kind of political decision to run the NHS down. And the junior doctors, sadly, have been driven to this point.
OK, can I just ask you a couple of things on a point of information? Just first things first, have you independently, as the BMA, approached ACAS, the conciliation service, to see if they'll act as arbiters?
Yes, we have.
And how did that go? What did they say?
We very positive.
And they're happy to do it. If the Department of Health say that they won't do it, what would you say to the department, who are no doubt listening to you right now? What would you say about the willingness that you have to work with ACAS and whether or not they should come to the table with ACAS?
Well, actually, you just stated that the BMA has an entrenched position. No, we don't. Do we have any preconditions? No, we don't. This is all coming from the government side, who wants to negotiate from a position where they have already decided what the answer is. We are saying it is not unreasonable for junior doctors to expect to be valued in the same way today as their predecessors were in 2008. These junior doctors, there's nothing junior about these doctors. They are in charge of whole hospitals at night. They are the first point of call. If you have a cardiac arrest, it will be the junior doctors that are saving your life.
Sure, and just to be really clear, I'm certainly not trying to suggest for a moment that your position's entrenched. I really want to understand your position. And on that point, your 35% request, can we just be clear, is that something you are prepared to compromise on? Is it a starting point? When Pat Cullen of the RCN, the Royal College of Nursing, was asking for a 90% pay rise, she came on this programme, she said elsewhere that that was a starting point and she was potentially prepared to budge. So can I ask you, on the issue of whether or not your position is entrenched, is 35 something, the 35% figure, something that you'd be prepared to move from?
Yeah, people are tied up on this 35% figure. There is no number that is set in stone here. It is the principle of restoring pay that has been lost in its value. In order to discuss what that means and how that is achieved, it needs people to sit around a table. This government does not want to sit around the table. It does not want to have any kind of independent arbitration of this because it's worried that it might cost it money. It is a complete fallacy that this cannot be afforded. It would cost about £1 billion, which is a big sum of money, but that's a quarter of the amount of PPE that they've had to burn because it was not fit for purpose. It's 1/37th of the cost of the test and trace system that didn't work. So, this is a large amount of money, but it's a small amount of money considering the returns that this government would get.
But what would you say, Dr. Banfield, to those who say, and say it respectfully, because they have the utmost admiration and respect for and gratitude towards junior doctors. They also understand that you're a trade union, but who say, by the same token, that there is a danger that the BMA is something of an outlier. In March, 3 health unions, GMB, Unison, and Chartered Society of Physiotherapy, agreed to call off strike action and to enter into pay talks. The Royal College of Nursing, as I've just mentioned, also did the same. And there are people within the sector who say that actually the BMA, what's striking is that you are something of an outlier here. And while people understand and respect your position, they might say that if you continue to be an outlier and there are significant further cancellations of appointments or operations, the public might turn against you.
What I thought was really interesting about our discussions with ACAS, because one of the points that I wanted to raise with them was, how abnormal are we being? Does everyone who goes to ACAS cancel their strike action while they are negotiating? No. Does everyone who goes to ACAS have to meet face-to-face? Because Mr. Barclay asked or demanded that our junior doctors who are in clinical practice in Manchester travel down to London for a half an hour face-to-face meeting. No, they've been doing hybrid meetings for several years. So, these junior doctors want openness and transparency. This government seems to want secrecy and everything to be done behind closed doors. We're in a different era now. These are young professionals who have choices. They are voting with their feet to leave the NHS. The gaps that are occurring because of that are making this service unsafe. It is unsafe outside of strike days, and we need to have the staff that make the system safe again.
We hear you loud and clear, but other unions in your sector who, like you, have a deep concern for the welfare of patients and went into the job and into the profession because they care about reducing people's suffering, other unions paused strike action to enter talks. Why weren't you?
Sadly, Well, sadly, I think this is the low trust environment that this government has generated.
Maybe you could help restore some of that trust with a big open gesture.
Well,
You could say right now, Dr. Banfield, you could say right now, you know what? We care so much for the welfare of these patients. We think over 200,000 appointments, listening to Helen a moment ago, is so appalling that actually we're going to make a big, bold, open gesture. We're going to say we will call off these strikes for the time being, and we will reserve the right to strike in the future, but we're going to enter talks. We're in a situation where millions of people are hearing Hugh Pym, our health editor, say this morning that the gap, the impasse between you and the government is so big that you're not even talking. That's an astonishing place to be.
Yeah, it is an astonishing. Absolutely. It's an outrageous place for us to be.
So why don't you make a big gesture and call off the strikes for the time being?
Well, of course, we haven't actually got a strike announced at this point in time. So, here is the time to get in the room and talk. It can be done rapidly. All it needs is a very quick discussion with the Prime Minister and the Chancellor of the Exchequer to say, do you know what? Actually, it will cost you less to start discussing pay restoration. If we start talking about pay restoration, then there gets hope. Then we start rebuilding trust, and then we can make progress. The pay in the NHS is the easy thing to sort out. The more difficult challenge is for us to sort out the backlog and getting on with the work, because that there are structural and processes that are much more difficult and much more challenging. And that's what we want to get round to doing, fixing the NHS.
If the Health Secretary, Steve Barclay, called you up today, rang you up and said he invited you in for a face-to-face meeting, would you meet him?
Yeah, I mean, it is absolutely bizarre. Okay. In 9 months, I've not had a face-to-face meeting with Steve Barclay. Why is that? I'm afraid his door doesn't appear to be open.
Dr. Philip Banfield from the BMA, thank you very much indeed for joining us.